Hello guys, welcome back to my channel. I am your Wongo Nation president, and today we are going to be looking at a very interesting topic, something that has affected some women, something that some people have been experiencing and they don't know what it is. So today you're going to learn something new from me. Chemical pregnancy is when a woman gets pregnant, but that pregnancy does not stay more than 5 weeks. In fact, it is a type of miscarriage, just that it is happening at a very early stage. Some people can have symptoms while they have chemical pregnancy, while others might not get any symptom at all because the pregnancy was at a very early stage and the loss also happened very early. Let's talk about how pregnancy happens. When you have sexual intercourse with your partner, there is going to be fertilization, which will happen in the fallopian tube. After fertilization occurs, that embryo that has been formed during the fertilization process is going to find its way back into the lining of your womb. The lining of the womb is also known as the endometrial cavity. When the embryo gets to the lining of the womb, there is going to be a series of events that will happen, and then implantation is one of those series of events. At the time when implantation occurs, that's when some of you will test positive for pregnancy. Implantation would usually happen 6 to 10 days after you have sexual intercourse with your partner. And after implantation, that is when the beta HCG will start increasing inside of your body, and then you can test positive through serum PT. While everything I've said sounds very simple or easy to achieve, it might not always happen like this. Sometimes it could be difficult for fertilization to occur, while sometimes implantation will not happen. You might be wondering what causes this. There are so many possible causes, but I am going to be looking at the 3 major things that can lead to you having chemical pregnancy. Number 1 is chromosomal abnormality of the fetus. During fertilization, the fetus itself could have abnormalities. It doesn't necessarily mean that something is wrong with the woman or with the man. It is usually an issue with the embryo itself. And when this happens, it can lead to you having a very early pregnancy loss. Majority of pregnancy losses that happen in first trimester is caused by these chromosomal abnormalities. Number 2, hormonal imbalance, usually low progesterone level. Progesterone is the hormone that makes the lining of the womb to grow and makes it very receptive to an embryo. This progesterone also helps to keep the pregnancy by not allowing contraction and relaxation of the uterus at the very early stages of pregnancy. If you are low on progesterone, then the lining of the womb might be very thin that it might not allow for implantation. And even when implantation occurs, then there could be a very early contraction and relaxation of the uterus, which can lead to pregnancy loss. So low progesterone is one of the things that can lead to early pregnancy losses. Number 3, structural abnormalities. So if you have things like polyp or even fibroids that are in the lining of your womb, there could be fertilization, but when it is time for implantation to happen, these things can lead to very early losses because they are at the place where the implantation should have taken place. Other causes of chemical pregnancy are things like diabetes, high blood pressure, health condition, lifestyle choices, and many more. Some of you might wonder how this chemical pregnancy might be identified. One of the things that you can notice is testing positive for pregnancy, and then a few days later you start seeing your period, or you test positive for pregnancy today and then tomorrow you start testing negative. There are different other things that can make those things to happen, things like hormonal imbalance, certain types of ovarian cysts, using a bad pregnancy test strip. But if you are noticing that you miss your period, you do a pregnancy test and it comes out positive, few days later you start having a period, it then raises concern for chemical pregnancy. Some ladies would even have symptoms of pregnancy like tenderness of their breasts, food aversion, sensitivity to smell, nausea and vomiting, and then few days later they start testing negative or they start seeing blood. If you've had this situation for a while, maybe it has happened to you 2, 3, 4 times, my candid advice would be for you to see a doctor and discuss your concerns. Women who have constant chemical pregnancy might benefit from things like scan or even hormonal profile tests. Scan will be looking out for things like polyps, fibroids, and also the thickness of the lining of the womb. Because these are some of the things that can increase the chance for you to have a chemical pregnancy. For your hormonal test, your doctor might check things like your progesterone level. Because if your progesterone is low, then that can also increase the likelihood of chemical pregnancy. If you've been having continuous chemical pregnancy and you test positive again, Book an appointment with your doctor. Early stages, your doctor can put you on certain medications to help reduce contraction and relaxation of the uterus. Things like progesterone replacement, which has to be prescribed to you by your doctor. And I wish you all the best. I am still your Wongo Nation President, and I will see you all in my next video. Bye.